With long COVID has launched a legal action against NHS Grampian over claims that they were medically negligent in her care. It's thought to be the first case of its kind in Scotland. Let's speak to Anna Hendy's mum, Helen Goss, now. Good afternoon to you, Helen.
Hi, how are you?
I'm well, thank you, and thank you for joining us. Can you explain why you decided to take this legal action?
Yeah, of course. It really is a last resort option. It's a case of we've been trying to access healthcare services for her for years. You know, she's been ill since March 2020, and now we're almost coming up to 4 full years, and we just couldn't get anything. There were just brick walls everywhere. Referrals to specialists were being denied multiple times. We were being denied care at home.
On what basis?
Because she's bedbound most of the time.
On what basis was this being denied?
Well, do you know, I asked them that question and I still don't have the answer. I don't know. But all they said was when neurology and immunology, we tried to get them to see her 4 times and they just said they couldn't help.
And has she had any medical help from the health board?
She did have an amazing physiotherapist through CAMS, and we saw her for a little while. But unfortunately, then Anna got reinfected and she was too poorly to do any physio. And not too long after, CAMS actually discharged her on the basis that apparently she wasn't sick enough for their services. And so we had to actually hire that physio privately afterwards because, you know, the trust and the relationship had been built up between the two and she was brilliant. But, you know, we were denied that through NHS Grampian. And now she's too sick to even have physio.
Right. So that was all quite late on. That was really last year then, was it?
Yeah. So she'd been under CAMS for 2 years, and just out of the blue, they discharged her in the summer of 2022, and she's really had nothing since. We've had refused referrals, rheumatology refused to do a video call. You know, she's bedbound. It's very difficult for me to get her to an appointment. And cardiology as well, they refused to treat her POTS because they didn't know how to do it. And they said, NHS Grampian said they would pay for a private specialist to treat her. So we went ahead and got the treatment, got the medication, paid for it, and then they rescinded their offer and said they weren't going to pay for it anymore.
My goodness. And you mentioned that Anna had got sick again. How is she at the moment?
Yeah, so we got reinfected early December. So she had COVID for her birthday, which wasn't much fun. And it's really had a massive impact on her. So she basically hasn't left her bed since. It's so disappointing because we were starting to see tiny, you know, glimmers of hope with the new medications that she's been on from her cardiologist, the private cardiologist, and now this latest infection had just set her right back again. So we actually have an appointment this afternoon with him. So I'm glad about that.
Right. I mean, ultimately, what do you want to come out of this legal action?
Do you know, what I really want is for NHS Grampian to investigate why this has happened. I want them to look at her whole case and see all of the multiple failures, all of the refused referrals, all of the barriers that we faced to access healthcare. I want to know why. Why did this happen and why is it still happening to other families? And I want them to, you know, put their hands up and say, yeah, okay, do you know what? She has not had good treatment. We have failed. This is not good enough. And, you know, her child rights to healthcare have not been upheld. I want them to admit that they have failed. And I want them to apologise to her, just to her, not to me. I want them to apologise to her, because they've put her through hell, and she's only 11.
And since 2020, when she got COVID, I mean, has she had any sort of has you been able to continue with education or anything since then?
Oh, that's a whole other story. That's been another battle that's happening concurrently. No, she was well enough to do a bit of education right at the beginning, and we had a lot of success with the amazing eSchool, which is an online school, which really needs more funding. It's amazing. But then she got a second infection. She was too sick to do any school. She could have done some at home, but unfortunately Aberdeenshire Council are not very good, and we tried to fight them for a good 2 years to get some education for her at home, and we didn't succeed. And now she's had 2 more infections. She's too sick to do any school, and ironically, now she is getting some education that she's too sick to do. It's just been, it's almost been comical how bad this situation is.
Just a dreadful sort of sequence of events for you. I mean, you're going to push ahead with this legal action, but from Anna's point of view, I mean, what do you think the next year or so holds for her?
I honestly have no idea. I'm really hoping that we can get control of her POTS. It's just, you never know what's going to happen after you get reinfected.
How does that affect her?
Well, the first infection was bad and triggered her PANS. The second infection put her in a wheelchair. The third infection gave her pain all over her body. And the fourth infection, well, we'll wait and see. I don't know yet.
And are you getting any treatment or attention for that at the moment?
Not from NHS Grampian, that's for sure. All of the private care that we have is in place of what NHS Grampian should have let us have access to. So we had to get a private immunologist who successfully treated her PANS, and she's in remission for that. We had to get a private neurologist who gave her medication that has taken away a lot of the pain, which gives her a lot more mobility around the house. So we have to pay for that. And now we obviously have to pay for the cardiologists, because NHS Grampian rescinded their offer that they were going to pay for that. So it's a lot. And honestly, my savings are at zero, negative. I have no money left. But this legal case is not about the money. I know so many families who have been through NHS Grampian and experienced very similar. And honestly, I put it down to the massive failure from the senior management at NHS Grampian and ultimately the Scottish Government.
Helen, thank you very much for speaking to me on Lunchtime Live. That's Anna Hendy's mum, Helen Goss, who is taking legal action against Grampian Health Board. A spokesperson for NHS Grampian said, we cannot comment on individual patient cases. They said a long COVID pathway of care for children has been designed with the input of those with lived experience of the condition, and it's in the final stages of development, along with a new website for families. And we also tried to contact or make contact with CAMS, but we haven't heard back from the service as yet. Now, the Metro